In this lecture for Chapter 2, we're going to talk about the anatomy and the function of the hand muscles. And the muscles of the hand they're grouped into three different groups, the thenar muscles, the hypothenar muscles, and the intrinsic hand muscles. And they're grouped by both location and then function as well. So first we'll talk about the thenar muscles, group of three muscles at the base of the hand on the radial side. So they're really these muscles right here located at the base of the thumb, and they're responsible for movement of the thumb. So again, location and function. They are all innervated by the recurrent branch of the median nerve. And the recurrent branch of the median nerve, so the median nerve comes in here like this, comes in through the carpal tunnel, and then it gives off a branch after it enters the hand that curves like this, and it gives innervation to all these muscles here, and then as the median nerve continues on. So that's your recurrent branch, okay? Just so we and we'll go over that in more detail in the nerve section of this section, okay? All the muscles originate from the flexor retinaculum and the radiocarpal bones, okay? And then this is just a look at one of the muscles pulled away, the abductor pollicis brevis. It gives you a view of adductor pollicis, which is not a thenar muscle. This is actually an intrinsic hand muscle, but it gives you a good view of opponens pollicis as well. So here's the table in your book. We'll go through each of these individually. This is just to give you a good summary of all the origin, insertion, movement, innervation, just like we've done for muscles throughout the chapter. So first we'll talk about opponens pollicis. So here opponens pollicis is shown here. So these three muscles, you have abductor pollicis brevis, which is the most superficial, and then deep to it you have two muscles. You have flexor pollicis brevis and opponens pollicis. Opponens pollicis is more lateral or radial per se. And the origin of opponens pollicis is flexor retinaculum, the scaphoid, and the trapezium bone. And then the insertion is the lateral side of the first metacarpal, and you can see that right here. Its movement is to oppose the thumb towards the center of the palm, so it carries out the movement of opposition, which is where you bring, the thumb is, raised up in the air and then brought towards the center of the palm. And then the innervation, like we talked about, recurrent branch of median nerve. Here's another good look of opponens pollicis. So this we've pulled away abductor pollicis brevis and flexor pollicis brevis, and just to give you a good view of opponens. Here's its nice insertion point, and then again, muscles contract, they shorten, so it's going to pull the thumb towards this part of the region. Okay. Abductor pollicis brevis, so that's the most superficial muscle. This is good. These layers are also good to keep in mind when you're dissecting, because often you can cut the abductor pollicis brevis and reflect it back to get a good view of the two muscles deep to it. Again, flexor retinaculum, scaphoid, trapezium is the origin. Its insertion is on the lateral side of the base of the proximal phalanx of the thumb. So you can see that here. Here would be the proximal phalanx. Movement, it abducts the thumb. So again, the movement is in the name, like several other muscles. Pollicis is another term to mean thumb. So again, the function is in the name, moving the thumb. And it helps oppose it. So it helps with opposition as well. And then the innervation recurrent branch of the median nerve. And so again, muscles contract, they're going to pull the thumb this way. Okay. Flexor pollicis brevis. So here's a good view of it here, just deep to the abductor pollicis brevis. Again, flexor retinaculum, scaphoid, trapezium is the origin. Insertion, it's on the lateral side of the base of the proximal phalanx of the thumb. So you can see that very nicely here. Movement, it flexes the thumb. Again, flexor pollicis meaning thumb, and then brevis, so it's in the name. This muscle, it contracts, flexes this thumb this way. Now, one thing to note is that the flexor pollicis brevis has two heads, superficial head and the deep head. So the superficial head is more in this region, and then the deep head kind of goes down into the deeper part of the hand here. And one way you can remember that is the superficial head is nice and superficial. It's right up here where the recurrent branch of the median nerve is passing. So that's the recurrent branch. The deep head goes more into the deeper part of the hand. And the deep muscles, all these deep intrinsic muscles that we'll talk about in a few slides, are all innervated by the deep branch of the ulnar nerve. So it makes sense based on the region of the muscle that you're talking about, because what's important to take away here is that the flexor pollicis brevis is a dually innervated muscle. So it receives innervation from two different nerves, and one is the recurrent branch, which makes sense. It's traveling through this superficial portion of the thenar area and gives innervation to the superficial head, and then the deep head comes down into this region here where the the deep ulnar nerve, the deep branch of the ulnar nerve is traveling, and can give an innervation to it here. Now we'll talk about the hypothenar muscle group. So it's a group of 3 muscles at the base of the hand on the ulnar side. So it's really right here, and they're responsible for moving the small finger, or also known as the 5th digit or the pinky finger. These are all innervated by the ulnar nerve, and they originate from the flexor retinaculum, the hook of the hamate bone, and then the pisiform bone. And again, here is a nice view of the one of the deeper muscles here. And this is the table in your book. We'll go through each of these in detail. So, abductor digiti minimi, you can see that is right here. So it's right here on the outside. And again, it's from the pisiform to the proximal phalanx of the 5th digit. You can see that nice insertion right here. Move abducts, again, it's in the name, digiti minimi, meaning the small finger. So that's what that means. And so this muscle contracts, it shortens. It's going to pull the 5th digit out this way. Deep branch of the ulnar nerve is the innervation. Flexor digiti minimi brevis is this muscle right here, just deep to the abductor digiti minimi. It's this nice thin muscle here, inserting here onto the proximal phalanx of the digit. Its origin is hook of the hamate, flexor retinaculum. You can see that here. Transverse carpal ligament is the same name as the flexor retinaculum. It's, again, like several structures in anatomy, has multiple names. It flexes the proximal phalanx of the 5th digit, which makes sense. It attaches onto the proximal phalanx, it's going to flex it. So again, muscles contract, they shorten, it's going to flex it this way. Innervation, deep branch of the ulnar nerve. Apponens digiti minimi, this is shown here. Again, like several things, in anatomy, many things can have multiple names. Here it's labeled apponens quinti digiti. It's the same muscle, more commonly known as in most books and in classes, apponens digiti minimi. Now apponens, it's in the name, opposition, digiti minimi, small finger, 5th digit. So it originates at the hook of the hamate and the flexor retinaculum. You can see that here. And then opposition of the 5th digit, so contracts like this, it moves it this way, okay? Opposition would be bringing the pinky towards the thumb if you're opposing both. Innervation, deep branch of the ulnar nerve. Palmaris brevis, this is a very small muscle here, as you can see. It originates from the transverse carpal ligament and the palmar aponeurosis, and you can see that right here. The fibers are going into this connective tissue band over the carpal tunnel, and then the palmar aponeurosis, which is cut away here, but it also originates on that. And then it inserts onto the skin of the ulnar palm, and when it contracts, it wrinkles the skin of the medial palm. Innervation is ulnar nerve. And then lastly, we'll talk about the intrinsic muscles of the hand. So these are responsible for the intricate movements of our fingers. They help give us our dexterity, help us to pick up small things or maneuver objects like a pen, like when we write. These are the muscles that help us do that. They are all innervated by the deep branch of the ulnar nerve, except for the 1st and 2nd lumbricals, which are innervated by the median nerve. And again, this is a table here. This is really the location of the intrinsics right here around base of the fingers and into the fingers. So we'll start with adductor pollicis. So adductor pollicis, it's in the name. It adducts, the pollicis meaning thumb. So that's where we get that here. It's in the name. This also has 2 heads, but it is not duly innervated. It has 2 heads. The oblique head, which originates at the base of 2nd and 3rd metacarpals. So here's the oblique head right here. You can see this very nicely shows you the 2 heads, transverse and oblique head. So this head originates on the 2nd and 3rd metacarpals, and you get a good look at that right here. This would be the 2nd metacarpal. This would be the 3rd metacarpal. You can see that. It also originates on the capitate and then adjacent carpal bones in here. The transverse head originates on the 3rd metacarpal, and you see that very nicely here. Here's the transverse head, 3rd metacarpal. It inserts onto the proximal phalanx of the thumb, and again, you see that very nicely here, which is the proximal phalanx, so it attaches here. Movement, adduction of the thumb. So again, muscles contract, they're going to pull this way, okay? Innervation, deep branch of the ulnar nerve. All right, so the lumbricals, these are sort of unique muscles because their origin, and they don't really attach to bones. Their origin is the flexor digitorum profundus tendons, which you can see traveling deep in here. That's where they originate. And then they wrap around the fingers, actually, and we'll show that on the next slide. we'll show that here. You have this is the dorsal aspect. So the lumbricals are going to wrap around and insert onto these tendons and these extensor expansions of the extensor digitorum muscle on the dorsal aspect of the hand. And so that's where they go from one tendon to the next is where their attachments are. Now, what do they move? You can see that here. So this right here is your MCP joints. And so they cross the MCP joints, and they are the principal muscles responsible for flexion of the MCP joints, 2 through 5 of the fingers. Obviously, they don't flex the MCP joint in the thumb, but they are for the fingers. However, what's unique is since they wrap around the fingers and insert onto this extensor expansion here of the extensor digitorum, they cross the PIP and DIP joints, but they cross it in such a way that they actually extend those joints, not flex them. So what's important, and this comes into play in our median and ulnar nerve palsies, because the median and ulnar nerve are responsible for their innervation. If you lose, say, the median nerve, you're going to lose flexion of the first 2 MCP joints, but then you're going to lose extension of PIP and DIP joints of those same digits. So you lose, it's kind of contradictory. You lose two different movements, 2 opposite movements, flexion and extension on the same digit at 2 different joints. And the reason for that is because the way in such it crosses the MCP joint, it goes across, and we'll show that on this diagram better here. So here's a lumbrical right here. This is the second lumbrical. If this lumbrical contracts, as you can see, it's crossing the MCP joint. It's going to pull this way and flex the finger on the MCP joint. Versus if it comes up here, and so here's your DIP joint, here's your PIP joint. If it comes up here to cross the PIP joint, again it extends. It's going to pull this way, which is, again, we're on the dorsal surface. It's going to pull the finger that way. Okay. So again, let's review that real quick just one more time. So you have these lumbricals. They're originating from the flexor digitorum profundus tendons. They cross the MCP joints shown here. So the MCP joints. So that's the first joint. So you can think of it as they cross 3 different joints. Okay. First, they cross the MCP joints. Again, they contract, they shorten. They're going to pull across this MCP joint, flexion. Okay. Then they come around and they go across the PIP joint and the DIP joint. And so if you have a tendon like this, they come across like this. If you contract like this, you're yanking on this distal phalanx, you're yanking on this middle phalanx, because you're pulling on this entire extensor expansion. By inserting onto the extensor expansion, it enables the muscle to act on both joints. It's not like the muscle has these multiple tendons that spray out and attach on all these bones. What happens is by inserting onto this extensor expansion, it enables it to act on both the PIP and DIP joints. So again, it comes across here, inserts onto the extensor expansion, contraction. It's going to pull on the distal phalange, the middle phalange, and the proximal phalange, and pull this way, giving you your extension. Okay, it'd be like this if you had, your fingers bent like this, and then you pull this way. It's just like anything else that you would pull that way. It's going to cause you to fully extend. And now, after all that complex explanation, again, first and second lumbricals are median nerve, so that would be these 2 here. Here's your first and your second. These are median nerve. Then here's your third and fourth. These are your ulnar nerve. Now we get to the interossei muscle. There's a dorsal interossei and palmar interossei. And here's this table. It's in your book, and we'll go through these. So the dorsal interossei, they're bipennate muscles, which means the fibers show like this. You have 2 sets of fibers that converge like this. And that's unique to the dorsal interossei versus the palmar interossei, which are unipennate. We'll show that on the next slide. Their origin is on the metacarpals, and you can see that here. These are the metacarpal bones. They insert on the extensor expansions in the base of the proximal phalanges of digits 2 through 4. So you can see that here, that they're inserting onto the proximal phalanges here. and then also onto the extensor expansion on the dorsal aspect, which you can see here. Now, what is their main action? So, a good way to remember this is your dab and your pads. So, dab would be dorsal interossei AB duct. So they abduct your digits 2 through 4. So if you ask someone to spread their fingers apart, the dorsal interossei are the muscles that are enabling them to do that. And as you can see, take the fourth one here, for example, it contracts, it's going to pull this finger out this way. It's just the way the attachments work. Muscles, again, muscles often can be, they seem daunting at first, but the muscles can be really easy to remember. As long as you just remember the structure, the origin and insertion, muscles contracts, and it's just where it's pulling that helps you with the motions. And then you just got to remember the nerves by the regions, the compartments, again, that'll kind of help you cut down on the memorization. Now, another important thing is since they cross all these joints, the MCP, and then just like the lumbricals, by inserting onto this extensor expansion, it helps them work on the PIP and DIP joints. So they help the lumbricals to flex the MCP joints and extend the PIP and DIP joints. Now, this comes in important clinically is since they're innervated by the deep branch of the ulnar nerve, if you lose these muscles, you're going to get some weakness in extension of PIP and DIP joints and weakness in flexion of MCP joints. So really by knocking out the ulnar nerve, you really lose a significant amount of flexion in the MCP joint of the third or of the fourth and fifth digits, your ring finger and small finger, because those lumbricals are innervated by ulnar nerve. And then you're also going to lose extension of the PIP and DIP joints, or significant amount of it as a result. Now, palmar interossei, remember these are your pads because they adduct. Now, these are the utipennate muscles, and you can see that here with the muscle fibers, kind of a single group of muscle fibers like this. Now there's only 3 of these muscles, and we'll explain why that is in a second. They're on the second, the fourth, and the fifth metacarpal. So here's the second, and here's the fourth, and here's the fifth. Okay, and the reason for that is that their action is they adduct towards the midline, and the midline here is considered the middle finger or the third digit. Okay. So their insertion is onto the extensor expansion of the digits 2 through 4, just like the dorsal interossei. They also insert onto the base of the proximal phalanges of digits 2, 4, and 5. So they have no attachment onto the third digit here. Their movement is, again, the adduct digits toward the axonal line, which is considered here at the middle finger or the third digit. So if you look at this, muscle contracts, it's going to pull finger this way. Same thing with the second one. Contract, shorten. Going to pull it this way toward the midline. Now, again, since they insert onto that extensor expansion and then they also cross the MCP joint, is just like the DABs, the dorsal interossei, and then the lumbricals. They also assist the lumbricals in MCP joint flexion and then extension of the PIP and DIP joints. And since it's deep branch of the ulnar nerve, again, if you have an ulnar nerve injury, it can affect these muscles as well as the third and fourth lumbricals, and then your dorsal interossei. So you'll have very weak movements of flexion at the MCP and extension at PIP and DIP joints. All right, and that concludes our discussion of the hand muscles.